Dear viewers, welcome you all to our show OSA, that is Orthopaedic Solution Academy. Hope you all are well during this Ramadan time. Dear viewers, today our topic is the role of Ilizarov in obesity, and the speaker is the one and only, the legendary Ilizarov surgeon of Bangladesh, Professor Mofakhkharul Bari sir. I would like to request Professor Mofakhkharul Bari sir to join with us.
Good afternoon, everyone.
Good afternoon, sir. Thank you very much for joining with us. Dear viewers, we have three learned academic experts with us. One of them is the highly academic expert from Kurdistan, Iraq, Professor Omar Barabi sir. I would like to request Professor Omar Barabi sir to join with us.
Good afternoon. Thank you so much for everyone.
Good afternoon, sir. Thank you very much for joining with us. Dear viewers, we have two another enthusiastic Ilizarov surgeon and academic faculty with us. One of them is Professor Novikov sir, and another one is Dr. Shamsul Huda sir. Hope they will connect with us in the coming part of our program. Dear viewers, we all know that we can use Ilizarov in many cases, but in obesity, how is it possible to use Ilizarov in case of obesity? And that will be discussed today by the legendary Ilizarov surgeon, Professor Mofakhkharul Bari sir. I would like to request Professor Mofakhkharul Bari sir to share his presentation. Sir, would you please?
Okay, thank you very much, Tanvir. My dear colleagues and the viewers, today I would like to talk on the role of Ilizarov in obesity. It's very interesting, and these are the accordingly all the time showing my places. This is still, I remember my Kiev, my Tashkent, and my center Kurgan, and this is our institute, now the 1,000-bedded hospital, and this is my present working place, my private place, and now let us see. The obesity is a complex disease involving an excessive amount of body fat. Look at the right side, the man. Obesity is not just a cosmetic concern. It is a medical problem that increases the risk of other diseases and health problems, such as the heart disease, diabetes, high blood pressure, and certain cancers. How to tell if you are obese? The most widely used method to check if you are a healthy weight is body mass index BMI. For most adults, a BMI of 18.5 to 24.9 means you are a healthy weight. 25 to 29.9 means you are overweight. And your weight is 30 to 39.9 means you are obese. So this is number 4. You can see I'm mentioning it again. 30 to 39.9 means you are obese. And last one, 40 or above means you are severely obese. So how to tell if you are obese? Now you can see the body BMI, body mass index here. 5 figures you can see here. And last one is the 40 or extremely that I told you earlier. If it is more than 40, then you are extremely obese. Now, what are the risks of obesity? It's very important to take steps to tackle obesity because, as well causing obvious physical changes, it can lead to a number of serious and potentially life-threatening conditions. These include type 2 diabetes, coronary heart disease, some types of cancer such as breast cancer and bowel cancer, and of course the stroke also. Now, what are the causes? Obesity generally caused by consuming more calories, particularly those in fatty and sugary foods, than you burn off through physical activities. There are also some underlying health conditions that can occasionally contribute to weight gain, such as an underactive thyroid gland, that is hypothyroidism. Dear friends, you can see obesity can cause a number of further problems, including difficulties with the daily activities and serious health problems. Day-to-day problems related to obesity include breathlessness, increased sweating, snoring, difficult doing physical activities, very difficult to do the physical activities, often feeling very, very tired, joint and back pain, low confidence and self-esteem, and of course the feeling isolated. always they feel isolated. Now, serious health conditions, if you think about the obesity, you'll see the type 2 diabetes, high blood pressure, high cholesterol, and at the same time, you will get the atherosclerosis. And especially obese patient, I am looking in the diabetic patients also the atherosclerosis. And metabolic syndrome, a combination of diabetes, high blood pressure, and obesity. Severe type of cancer, including bowel cancer, breast cancer, and womb cancer. Gallstones, osteoarthritic changes, a condition involving pain and stiffness in your joints, liver disease, and kidney diseases as well. Now, in 2021, World Health Organization, they defined obesity as risk endemic epidemic proportions globally, with at least 2.8 million people dying each year as a result of being overweight or obese. Once associated with the high-income countries, obesity is now also prevalent in low and middle-income countries. Government, international partners, civil society, non-governmental organizations, and the private sector all have vital roles to play in contributing in obesity prevention. Now, 6 types of obesity are, you can see here, food obesity, thickness due to nervous stomach, gluten diet, genetic metabolic obesity, and venous circulation obesity, and inactivity obesity. These are the 6 types. So now, facts about the obesity. World Health Organization global estimates follow. Overweight and obesity are linked to more deaths worldwide than underweight. 39 million children under the age of 5 were overweight or obese in 2020. These are the data given by the World Health Organization. This is usually the result of an imbalance between the calories consumed and the calories expended. Children's diet and physical activity habits are influenced by their surrounding environment. Curbing the global obesity epidemic requires a population-based, multi-sectoral, multidisciplinary, and culturally relevant approach. Overweight and obesity are defined as abnormal or excessive fat accumulation that may impair health. More than 1.9 billion adults were overweight in 2016 and 650 million obese. Think about all this data. Now, eating a healthy diet can help prevent obesity. People can maintain a healthy weight, limit total fat intake, and shift fat consumption away from saturated fats to unsaturated fats. Increase consumption of fruit, vegetables, pulses, whole grains, and nuts. And you must limit the intake of free sugar and salt. These 2 A's is very important. And regular physical activity can maintain a healthy body. If you do the regular physical exercise, you can have a healthy body. People should engage in adequate levels of physical activity throughout their lives. At least 150 minutes of regular and moderate intensity physical activity per week reduces the risk of cardiovascular disease, diabetes, colon cancer, and breast cancer. So now I'm showing you the obese people that I treated them. You can look here. This is no cloths I'm showing. They are also fatty. It is 180 kg. These are the men. He's from the outside my country, from Somalia. These are all my patients I treated with traumatic problems. See, size of the ring, normally 60 to 240, normal person. Over 240 for obese person. It's very difficult. Just look at the thigh, left side. And these are the normal size parts of the Ilizarov. Here, this is Russian arches. You can see these are the telescopic nails, wires, bars, two-shaped blades, and these are the female post and male post and the long plates. And Now, look at the case. Now I'd like to share my case. A gloomy face of the patient from Somalia. He was operated 18 times in 5 countries. Very tall and very big, and thigh, look at the thigh. See, he was operated in Uganda, in Germany, and ultimately came to Dhaka, Bangladesh, and weight is 130 kg, infected non-union, sharp femur with implant in situ, with broken screws, with discharging sinuses. Look at this here. See the measurement of the thigh. And this is the X-ray. Non-union, you can see how to tackle this. You cannot tackle this kind of infected non-union without Ilizarov. And putting Ilizarov, not so easy in this kind of big thigh with infected non-union. Now look at the femur here. I have especially ordered to make these arches. These are all more than 240, and this is a long plates you can see here. And if you look at the X-ray from this side, this is connected with the oblique arch support, and lower in the lower femur you can see very big ring, and of course the multiple K wires with console wires, and wire size in this case of thigh I applied 2 mm Ilizarov wire or K wire. Look at this. This is oblique support. Look at the console wire. Console wire touching from one cortex to another cortex. If you put the console wires and gradually if you pull 3 or 4 times a day, you are increasing circulation intramedullary, which will help to reduce the infection in the whole bone. So these are the 2 mm olive wires you can see here. Now look at this. If you see, it will look just like a very clumsy, but not clumsy. Just look at this here. These are the chances, 1 or 2, and I have put the multiple K wires, console wires, and multiple K wires. So look at this before treatment, after treatment 6 months, and this is the before. You can see the intermedullary nail. Here was a discharging sinus, and now see after full treatment showing regenerated bone with good consolidation. So this is the case that you can see how he is walking after treatment of 6 months. 6 feet 3 inches, the big thigh. Now he's happy. Before that gloomy, now the smiling face. So this was a challenging case for Ilizarov, very big thigh. Now let us see the case number 2. 180 kg comminuted supracondylar fracture, left femur with intra-articular extension. 54 years old male, Mr. Gomez Brian. It was a challenging case. Before coming to my place, he consulted 17 orthopedic surgeons here in Dhaka, and everybody refused. Ultimately, 2 of them, they sent the patient to take consultation from me. Look at this CT scan of the patient. Then whenever I have seen the patient, I was extremely, worried about the big thigh. So at the same time, I thought I have Ilizarov, then still I can help the patient. And patient, you can see here in the operation table, this patient in the operation table, look at the thigh and look at these sizes. 2, I've attached 2 Russian arches, very big, 1 and 2, and then 2 mm Ilizarov wire I have placed here under CR control. You can see here. So ultimately, the patient was he was lifted up by crane. Very difficult to lift the patient. And then see in the hospital. That is, I did this case in Bangladesh Institute of Health Science. Look at this. After taking the patient to the ward cabin, and this is the view of the external view of the whole ring area in the thigh, 180 kg. This is not a matter of joke. And then see, after removal of Ilizarov apparatus, then for a while, 3 weeks, I put the plaster immobilization, and then see, after removal of the ring and plaster immobilization, patient, if you want to lift the patient, you should have to take the help of 5 or 6 people. Otherwise, very difficult to lift him. And see, my physiotherapist, Russian physiotherapist, she's working in my place, and physiotherapist is doing the exercises. And now this is the consolidated bone. Look at these after putting the Ilizarov. Now he's standing up with the help of the crane. Look at this here. This is at his home. So very interesting. And case number 3, look at this. Infected non-union, 110 kg weight, 22 years old lady. Look at the thigh. This is the whole, both hip, both knee, both ankle. Look at the thigh. He was treated elsewhere with interlocking nail, and screws were broken, though he had non-union, interlocking elsewhere. Then came to my place, and again difficult to handle. Look at the thigh, big thigh. I removed everything, and this is a special cord for putting the thigh in a bed. Patient with the Ilizarov device. Here you can see, now you can see the whole ring area of the, because supracondylar region, I shall have to put, I put the another ring in the lower tibia just to maintain their stability. So this is the ring size. This is from the external view, you can see here. And this is the before treatment. This is after 4 months, you can see here. And this is the lady. And look at this again, 115 kg, 34 years old lady, infected non-union, treated elsewhere, comminuted shaft of the right femur with plate and screws. Now see the big thigh, just, shadow, you can see here. And now I'm looking at this. See from the back side, since the patient is suffering with infected non-union, you have no any other alternative way to go for that. So that's why I have removed the plates and screws. Now you can see here on the upper part, I have put the 2 chances here, and otherwise in the middle and lower third, put the olives and the wax. So 2 mm Ilizarov wire, I have all these 2 mm Ilizarov wax. Now, patient is on A4 after removal of the A4, ankle, foot, and thigh, not A4, thigh, foot, brace, not A4, thigh, foot, brace. And this is the clinical appearance of the patients after 5 months. You can see here a consolidation is going on. And this is the patients after 8 months. Now she could stand. So the final result is here after 8 months. You can see here from this situation to that situation. And now another case, young gentle boy, you can see here, rather I should say, he is running 120 kg overweight. These are all the cases. Ring size is almost 200, near about 300 mm. Non-union right femur with interlocking nail again. See. So then I have removed, look at the thigh, tall guy, big thigh, and then again I have put the Ilizarov. You can see here oblique support, telescopic oblique, and then multiple KYs. And then we have treated this one before and after. Now after 9 months follow-up. The patient is happy. Now you can see the consolidation full here. So these are the cases, dear friends. Ilizarov fixator has biological principles of gradual destruction revolutionize the management of limb deformity. I've always loved to tell all these things. Here are the 8 points. You can see here limb length discrepancy, you can overcome that one. Bony and joint deformities, you can solve. soft tissue contracture you can solve, bone loss you can solve, and you can solve the delayed and non-unions, and of course you can control the infection. Whenever you need to do the distraction, you can go with the transverse distraction, and of course the peripheral vascular diseases with the diabetic foods, you can, that is the ischemic limbs, you can treat very easily. Challenges in Lyme comes in three categories. This is, I love to again say this: easy, difficult, and impossible. Those who take the easy way have a safe and boring life, and those with the difficult way have a tough but satisfying life. But those taking the impossible way, when you are treating these impossible cases with obese patients, they were remembered forever by the patient or patient's relatives. So this is, I must say, you must know the gentleman, Professor Oganessian. He is from the CITO, Central Institute of Traumatology, Moscow. I know the, Oganessian, Volkov Oganessian apparatus in 2003 when I was in Moscow, Central Institute of Orthopaedics. He taught me. He was the rival of Ilizarov. And only the half rings used by Oganessian apparatus. So, and finally, these are the cases that I've shown you on the basis of evidence, all the fatty obese patient. And of course, everything is related to the science and skill of the surgeon that I try to do the Ilizarov apparatus. So these are the challenging cases. And for doing this surgery, you must know the technology. And Ilizarov apparatus, this is biologically and mechanically established. And we can help this kind of people by doing Ilizarov surgery, and you have nothing to be feared. Nothing to be, think about that the cage is too fatty, so you can make. Because the advantages of Ilizarov is that it's customizable. It's customizable, can articulate across the joint. And it doesn't help, it does not do any kind of impairment by putting the Ilizarov wires in the thigh. Especially what I have shown you, these are the cases in case of thigh that I have shown you. These are my publications, and thank you very much for your kind attention.
Thank you very much, sir, for your excellent presentation. And that was an unique presentation, I think. Now, I would like to request Professor Omar sir to say something regarding the presentation. Professor Omar sir, would you please? Sir, you have to unmute yourself.
Sorry?
Mm-hmm. Yes. Yes, sir. Yes, we can hear you, sir. Please continue.
Yes, it's okay. Very nice presentation. Thank you so much for Professor Bari. I want to add 2 points. One of the points is that drainage of the pus by gravity. Whenever I am facing such cases, I am encouraging the patient that to be in that position to lie, that the sinus will be the lowest part. So gravity has a very important role for drainage of the pus, and our job will be much more easier. This is one of my observations. The second thing is that I would like to ask my friend to take more information about the counseling wires. What do you mean by console wires?
Console wires.
Yes.
The console wires, because the cases that I've shown you, the Somalian, that gentleman, console wire, if you put the multiple console wires from one cortex to another cortex, so multiple console wires, and when you are giving distraction, pulling the wires, and you are increasing circulation, because throw and throw, you cannot go through, because the thigh is very big, and since the patient is suffering with infection, that is infected non-union, that's why I put the console wires, to increase circulation and to eliminate infection. That is the idea.
Thank you so much. Thank you so much.
Thank you very much, sir. Now, I would like to request Dr. Shamsul Huda, sir, to share his knowledge regarding the presentation.
Thank you, Dr. Tanvir. Thanks for a wonderful presentation. These are one of the most difficult cases, most obese patients in Ilizarov we can handle We put up Ilizarov, it's not stable. We need to put more wires, most pins, and still we find that it's not stable and it goes in non-union. So it's a real great learning. Sorry for joining late, but it's real great learning. Every day we feel that we are doing good, but still we have to learn a lot in this case, sir. Thank you, sir.
Yeah. And so you don't need to worry. Okay.
Yes, sir.
Yes, sir. Yes, sir.
If it is in your hand, you will be able to do something. I am telling you.
Right, sir.
Challenging case. Thank you very much.
Thank you, sir.
Yes, sir. Thank you, sir. Sir, then what will be the size of the wires and
Whereas,
the olives?
if fatty, you can use 1.8, but I used most of the times 2 mm. These are the wires and olive I've taken from Kurgan, and I have special these cases. 2 mm and normal length, and I made my here with my lead machine with the long size of the wires. And the Russian olive wires, 2 mm, they're long and very big. So I did not face any problem with these kinds of wires. And particularly, even in Russia, they are fatty people, but not too much like this. That 5 patients, I've shown you 6 patients. These are the fatty patients, and I had to make the frame a special water to apply in the thigh. Okay. Normally, you cannot find 60 to 20 to 40. This is available.
Yes, sir.
Sir, what is the maximum number of ring size and arches you have used in the obese patients, sir?
300 mm, 300 mm, and arches maximum big Russian arches.
Yes.
Yes. Sir, is there any delay of in the rate of union in comparable to the normal patient and the obese patient?
I understand. No problem. Only you should have to, frame construction, and if you make your full frame stable, then union rate is almost the same. Nothing to be worried. Here I have shown you the 23, 28, 40, 45, and 54 is the highest one. So these are all young chap, I can tell you, and I did not face any kind of non-union with these fatty people, obese people. So thank you so much.
Yes, sir. Thank you very much, sir, for your excellent presentation. And dear viewers, I would like to thank you all, as because of this is the last program before Eid al-Fitr. I would like to say Eid Mubarak to all of you, as because of we will connect in the next Friday with another topic, and the coming Friday will be vacation for our Eid al-Fitr. I would like to thank Raj TV for arranging this type of academic program, and definitely Malia CNT Specialized Hospital Bangladesh Limited for sponsoring our program. And I would like to thank to our honorable speaker and academic expert for being with us. Dear viewers, I am Dr. Tanvir Ashraf saying bye-bye to all of you. Happy Eid Mubarak and Ramadan Mubarak to all of you. Bye-bye.
Okay, bye-bye.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe our channel.
Sir, Shyam.
Yeah. So the next Friday, Professor Omar sir will be the speaker. This topic will be the complex ankle and foot deformity. And I think we can make some variations. Dr. L. Prakash sir wanted to present about the framing of the Ilizarov.
His basics in framing, this is very good.
Very good, very good. I know that. And he was very much interested to present that things. It will be, I think it will be great if you talk to L. Prakash sir. Sir, what about the at least 3 or 4 session for L. Prakash sir especially? He is a genius. Right, although lots of controversies are there, but he is a genius.
Doesn't matter. He's a genius.
He is a genius. So we have to put the genius. And exactly. I think that will be a great helpful for the young surgeons. The framing of the Ilizarov.
We can start some series of basic courses, basic and advanced online courses. Basics of tibia, basics of humerus, basics of joints, basics of all the basics.
Yes.
Because we have been high-fi lectures, right? It's time to make people learn how to do Ilizarov.
Yes, definitely. Then we can plan for that. Already, El Professor has established that things. He has started some online courses. We can also start that too.
Faculty like Harshad Shah sir, Arya Agrawal sir, they teach basics very well. They're master of basics.
Yes.
Mangal Parihar sir, yeah.
Definitely. Then what will be our plan in the next month, the month of May after Eid al-Fitr?
We'll be doing another basics of Ilizarov. We can also request Dr. Novikov sir, because his way of teaching, because people go to Gurgaon to learn Ilizarov. If you can give up basic teaching of this is like this to apply basic frame, wires, rings, if somebody can teach. Or you can do one basic lecture and one advanced lecture. You can do also that. Because basics are very important. Shoulder,
basics,
arm, elbow, everything.
Yeah, already we have shown the arm and the forearm basics in the earlier part of our program, but I think we can